When it comes to liver health, it's easy to overlook the subtle signs of trouble, especially since the liver is known to be a resilient organ. However, ignoring these signs can lead to more serious health issues down the road. Liver disease can creep up on you without loud warnings, leaving you to discover the damage too late. In this article, we'll explore some strange, yet vital signs that could indicate liver damage and why it's important to act quickly. Gynecomastia, when your chest gets a little too puffy. Imagine this: one day you wake up, look in the mirror, and notice that your chest looks different. Not in a "I've been working out" kind of way, but more like a "why are my pecs suddenly puffy" sort of way. If you're a man, this could be gynecomastia, and it might signal liver damage. The liver's job is to regulate hormones, including the balance between testosterone and estrogen. But when the liver is underperforming, estrogen levels can rise, causing an increase in breast tissue. What's more, if you're consuming alcohol heavily, this risk skyrockets. Alcohol doesn't just hurt your liver, it also messes with your hormone levels, mimicking estrogen in your body. So if your chest is suddenly giving off man boobs vibes, don't just hit the gym check-in with your doctor. Your mouth and eyes feel like the Sahara. Dry eyes and a parched mouth? No, this isn't just dehydration or an after effect of a long night out. One of the more peculiar signs of liver damage, especially linked to autoimmune conditions like primary biliary cholangitis, is extreme dryness in the mouth and eyes. This happens when the liver's bile ducts begin to fail. And since bile is crucial for digestion and removing waste, its buildup leads to some strange bodily reactions. Around 30 to 50% of people with PBC suffer from these symptoms, which can be quite uncomfortable. So if you're constantly feeling like you need eye drops or your mouth feels like it's filled with cotton, don't just chalk it up to the weather. Your liver might be begging for help. Musty, garlic-scented breath. We've all been there, caught with a little garlic breath after devouring some garlic bread. But what if your breath starts to reek of garlic without you touching anything remotely garlicky? Weird, right? This unusual symptom, known as fetor hepaticus, is a telltale sign of liver dysfunction. When the liver fails to filter toxins properly, sulfur compounds accumulate in the bloodstream, leading to a musty or garlicky smell on your breath. Ancient physicians used to diagnose liver problems just by sniffing their patient's breath. While we're not advocating for sniff tests, modern research backs this up. So if your breath smells like a garlic farm and you haven't indulged in Italian cuisine lately, you might want to have your liver function checked. Your belly looks like you just ate Thanksgiving dinner. Let's get one thing straight: bloating after a huge meal is normal. But what if your belly looks like you feasted on Thanksgiving dinner and you haven't even touched food yet? This can be a sign of liver-related swelling due to ascites, a condition where fluid builds up in the abdominal cavity. When the liver isn't filtering blood properly, pressure builds up in the veins, causing fluid to leak into the abdomen. Ascites doesn't just make your belly look rounder, it can also make simple tasks like tying your shoes feel like an Olympic event. While a bit of post-meal bloating is common, persistent or severe abdominal swelling shouldn't be ignored. It's a red flag that your liver needs attention ASAP. Itchy skin that won't quit. Scratching your arm once in a while? Totally normal. But if you're constantly scratching like a cat with fleas, you might have a bigger issue at hand. One strange symptom of liver damage is persistent itchiness, caused by the buildup of bile salts in the bloodstream. When your liver can't process bile properly, these salts accumulate under the skin, causing that maddening itch. And no, this isn't just the occasional itch we all get. This is the kind of itch that can drive you to the brink of insanity. If you've been slathering on lotion to no avail, and the scratching just won't stop, it's time to stop blaming dry skin and start thinking about your liver. Yellowing of the eyes and skin, jaundice. Now, here's a sign that's hard to miss, but still strange enough to make the list. Jaundice occurs when your liver is unable to filter out bilirubin, a yellow pigment produced from the breakdown of red blood cells. The result: your skin and the whites of your eyes turn a distinct yellowish hue. While it's one of the more well-known signs of liver damage, it's also one of the clearest warnings that your liver is in serious trouble. Bilirubin buildup can be caused by conditions like hepatitis, cirrhosis, or even blockages in the bile ducts. So, if you're looking in the mirror and noticing that you're turning a shade too close to Simpson yellow, it's time to ring the alarm on your liver's health. You're getting bruised like a peach. Do you bruise easily after minor bumps, or sometimes without even knowing how you got them? While bruising isn't always a big deal, frequent and unexplained bruises can be a sign that your liver isn't doing its job. Your liver produces proteins necessary for blood clotting, and when it's damaged, this production slows down, leading to easier bruising. Think of your liver as the factory making essential clotting ingredients. When the factory goes on strike, you're left with bruises from the slightest tap. So if you're looking more like a Dalmatian than a human, covered in random bruises, it's time to check in with your liver health. Tremors and shaking hands. Shaky hands aren't always just a symptom of too much coffee or nerves. If you find your hands trembling uncontrollably, it could be a sign of liver damage. Tremors occur when toxins that should be filtered out by the liver accumulate in the body, messing with your motor functions. This condition, known as hepatic encephalopathy, can start subtly with mild hand tremors but can progress to affect the entire body if untreated. While shaking hands might seem like a minor inconvenience, they could be an early warning sign that your liver is failing to do its job. So if you find yourself shaking more than usual, it's time to see a healthcare provider. Blood in vomit or stool. Here's where things get a little scarier. If you notice blood in your vomit or stool, it's not just weird, it's potentially life-threatening. This often occurs in advanced stages of liver disease when varices or swollen veins in the digestive tract begin to rupture. Varices are a common complication of cirrhosis, and bleeding from these veins can lead to a medical emergency. If you experience this symptom, don't wait, call a doctor immediately. While it's one of the most alarming signs of liver damage, it's also a clear indicator that the liver's health has taken a dangerous turn. Confusion and foggy thinking. Have you ever had those days where your brain feels like it's wrapped in fog? If this confusion becomes chronic, it could be more than just a lack of sleep. It could be a sign of liver damage. When the liver fails to remove toxins from the blood, these toxins can travel to the brain, leading to a condition known as hepatic encephalopathy. This condition doesn't just cause forgetfulness, it can affect your mood, concentration, and even your personality. If you find yourself feeling unusually confused or mentally foggy, don't just write it off as stress. It might be your liver crying out for help. And there you have it, some truly bizarre signs that your liver might be in trouble. So if you've noticed any of these symptoms, don't wait, get checked out and give your liver some love. If you learned something new, don't forget to give it a thumbs up and make sure you hit that subscribe button and ring the notification bell so you never miss an update. Thanks for watching, and remember, your liver will thank you too.